Are you finding yourself urinating more than normal? Or do you feel a constant sense of thirst? Or are you eating more than normal while still losing weight? These are all symptoms that my aunt described to me that happened to her 5 years ago when she was diagnosed with type 2 diabetes. I've learned a lot about this condition from my aunt during the last few years, and I did additional research while preparing for this speech. Today I'd like to inform you about the nature of diabetes, the symptoms that manifest, and the different treatment options. First, let me begin with the nature of diabetes. There are several different types of diabetes. First, there's type 1. Type 1 was once known as juvenile or insulin-dependent diabetes. It is a chronic condition in which the pancreas produces little or no insulin, a hormone that is needed to allow sugar or glucose to enter the cells to produce energy. The people most often affected are young children. However, it is also possible to develop it in adolescence or in adulthood. Then there is type 2 diabetes. This occurs when the body becomes resistant to the effects of insulin or doesn't make enough insulin. The people most affected are most often adults. However, it is happening more and more in children due to the increasing epidemic of obesity. There is a link between obesity and insulin resistance. And lastly, there's gestational diabetes. This occurs during pregnancy. It is defined as any degree of glucose intolerance with the onset of first recognition during pregnancy. Now that you know something about the different types and who are affected, now let's look at the signs and symptoms for each. There are a number of different signs and symptoms to look for when detecting diabetes. Type 1 symptoms are increased thirst, frequent urination, extreme hunger, weight loss, fatigue, and blurred vision. The symptoms for type 2 are the same as type 1, however there's also slow wound healing and frequent infections. Also, they have a symptom of darkened patches of skin, usually in the folds or creases of the body, usually in the armpits, and this is a sign of insulin resistance. And for gestational diabetes, for most women it doesn't cause noticeable signs or symptoms. However, in rare cases, they may develop excess thirst and frequent urination. Given that there are different types of diabetes, you're probably wondering what kind of treatment options are out there. The treatment for type 1 diabetes, because of the fact that the pancreas makes no insulin or produces very little, it is important to supplement with insulin. It is delivered by injections or insulin pumps. There is no oral insulin because it breaks down in the GI tract. Also important treatment is regular exercise to maintain a healthy weight, and eating healthy foods such as low carbohydrate diet with moderate protein and low glycemic foods. Carbohydrates break down quickly into glucose in the body, and the glycemic index is based off of how fast a food breaks down to glucose. So in a range from 0 to 100, table sugar would be 100, and oatmeal or brown rice, more complex carbohydrate, would break down slower and have a rating of about 12. It's also important to monitor your blood glucose levels if you're diabetic. The optimum blood sugar levels for the day, for daytime, is between 80 and 120 milligrams per deciliter, and the goal for bedtime is between 100 and 140 milligrams per deciliter. And then treatment for type 2, then it is really important for diet and exercise to maintain a healthy weight due to the fact that most type 2 diabetes is a result of obesity. Exercise has been shown to help with insulin resistance in getting the glucose into the cells. There are also oral medications that help with insulin resistance, such as metformin, glipizide, GPL agonist, and meglitide. And for people who are not able to control their blood sugar with the oral medications, the last resort is insulin injections. For gestational diabetes, due to the fact that pregnant women are in a sensitive stage, it is important they try to first manage blood sugar with diet, same as for type 1 and type 2, with a lower carbohydrate, low glycemic diet. They are also, they need to monitor their blood sugar levels, and if they're resistant as well to the just diet and exercise, they will give them insulin injections. Some doctors do promote moderate exercise if there are no medical or obstetrical contraindications. As we have seen, diabetes is a serious disease that affects people of all ages. Hopefully I've successfully explained the nature of diabetes, signs and symptoms to look for, and the various treatment options. I would like to learn more about this disease throughout my nursing education, and I hope to one day be a diabetes educator. I know I won't be able to cure my aunt's diabetes, but hopefully I will be able to help her manage it so she can lead the best life possible. Thank you.